audio, and then we will get started. I want to thank everybody for being with us this morning. My name is Trish McFarland. I'm the president of the Delaware County Chamber of Commerce, and we're thrilled to bring you another webinar. As we know, we have shifted our focus to more of a virtual capacity, and we're really excited to bring today folks that have not been able to shut down or work from home. So as many of our local businesses and their operations have switched to remote work, there are several businesses that have been up and running because there are no alternative methods, and they are essential services. These business owners and essential personnel have experiences that the rest of the community can learn from as their employees begin to re-enter the workplace. So this morning we have a panel of experts. Erin Baker, who's the clinical hospice liaison from Compassionate Care Hospice. Sallie and Clark Bongaardt, who are co-owners and CEOs of Comfort Keepers, and Kevin Kearns, CEO of Tri-State Training and Safety Consulting. So I want to remind everybody, if you're new to these webinars, if you have questions throughout the program, please either type them into the chat or the Q&A, and we will ask them at the end of the program. Or if you have questions afterwards, we will certainly connect you with the panelists this morning. So first, we're going to start with Erin Baker, who is the clinical hospice liaison for Compassionate Care Hospice, as I mentioned before. Erin, can you share some of the happenings over the past 10 or 12 weeks? I can't even keep track anymore. How are things going for you?
Things are going. They're slowly starting to get better, if you will. You know, when I first started, I was doing nursing visits with hospice, and then I kind of transitioned into this clinical liaison role. You know, unfortunately, but fortunately, I've been working from home a lot. However, our team is still in the field. You know, we're dealing with, you know, the same struggles as far as like most people in healthcare. In the beginning, it was a little bit of struggle with PPE. We did have enough, but then we didn't. I will say we were pretty lucky to our team. We were COVID free, if you will. Basically, just it's been a crazy, crazy time. I personally have lost access to many facilities, the hospitals, you know, as everything is shut down. So I am accessing, you know, I'm trying to do virtual education with the, you know, the accounts that I have. Our nurses are still permitted to enter. Now, they've been restricted to so many visits in a 2-week period, you know, per Medicare requirements. So that's been a little bit of a struggle for patients because, you know, during this time, we haven't been able to give the patients the full experience or gift of hospice, if you will. You know, we have a social worker, we have a chaplain, we have other avenues, volunteers, music therapy, different things to offer, and all of that has been restricted. So it's been a struggle for us, but also a struggle for our patients, which has been a huge concern over the past couple weeks. We have, you know, we were accepting and are accepting COVID positive patients. We are separating our staff as to, you know, certain nurses are specific to certain accounts with COVID, you know, COVID versus non-COVID, to try to keep the residents, home residents, and different residents who are not COVID positive safe. A lot of the home residents that we have are, you know, not wanting us to come in because of the fear. So we're kind of we're doing the virtual visits with them. Basically, you know, that's pretty much what's been going on with us. Now we are starting to gain more access, which is good. I myself, a little bit treading lightly here with physician offices and, you know, nursing homes and not really so much the hospitals, but we're trying, you know, I'm starting to get back out into the field a little bit more than I was. We were very supportive of the accounts that we have with the, you know, for the nurses. I was out, you know, dropping things off at the facilities, you know, trying to keep things positive for the most part. So that's pretty much what it's been like for the past couple weeks for us.
Erin, can you talk a little bit about keeping the nurses kind of focused and not focused, motivated? You know, because I know that it's probably really hard to keep positive and things like that. Is there anything that you're doing differently, or?
I'm not sure what we're doing differently. I mean, our nurses, you know, we have a great team. I will say that everybody's been really focused, really positive on our end, and just trying to get out and see the patients as much as we can. And, you know, also in those different facilities that we have, trying to keep those nurses positive too, like bringing them things, positive notes I've been doing, emails, virtual, trainings and whatnot, just trying to keep everybody focused and positive. We were dropping off food and whatnot to the places. So just anything we could think of just to keep the positivity going.
That's
Signs
great.
on those things.
That's great. Thank you so much. So I want to remind everybody as we go through, if you have questions, put them in the Q&A or the chat, and we will come back to them at the end of the program. So now I'm going to move along to Clark and Sallie Bongaardt, the co-CEOs and owners of Comfort Keepers. Clark and Sallie, how are things going for you? I know it's not been easy.
Well, it hasn't, and I feel as if the virus hit us quickly. We were just moving along, and things shut down quickly. For us, it was fear. We were addressing fear in the beginning, and there was a lot of fear with clients. There was a lot of fear with families. There was a lot of fear with our caregivers. So communication became a huge piece of that. We have continued to talk to our clients and our family members of the clients weekly, as well as our caregivers. But we moved quickly to put into place things that would help in address the fear issue. For instance, the caregivers were immediately colloquied through an online clocking in and out system that we have for COVID symptoms. And during that colloquy, if they would answer yes to any symptom, for instance, do you have a fever? They would say yes. They would not allow that caregiver to clock into the shift. So that went a long way to quell to the clients that there was the issues were being addressed from a safety perspective. PPE equipment was very hard to get in the beginning. We felt like we were almost caught with our pants down. Kevin kind of saved us once we found him. But in the beginning, that was a challenge for us. We had plenty of gloves, but masks were a big issue for us to get. Once we got that, we're home free with that. CDC requirements, we had to get on board quickly with those CDC requirements, re-educating the caregivers with universal precautions, with infection control. We sent them all to reminder webinars on, how to properly wash their hands and all the infection control requirements that are being done. And again, communication with the clients, we were able to get that information out to them quickly so that their fear quelled. Back to the PPE, the challenge with the PPE was with our dementia clients. So when you go in to take care of a dementia client and you're wearing a mask, there's some real caution there, some real fear. They don't understand. So addressing that and trying to get over that hurdle to keep the caregiver safe, the client safe, while addressing the mental health or the mental issue that's going on with your client was a challenge with us as well. Administratively, caregiver recruiting was a big challenge. Nobody was applying. We do face-to-face, hands-on interviewing and training, and that had to be stopped. So flipping over to, webinar and Zoom interviews and Zoom training and online training was a real challenge for the team. We're just recently seeing, probably in the last week or two, some more free up. People are out in the caregiving field looking for employment, which is great. The caregivers that stayed with us, that weren't afraid and pulled back and took leave of absences, have been overworked. They're exhausted, picking up a lot of overtime, but their commitment to the client base has been fabulous. But again, they're working long hours, they're tired, we need to get them some relief. We had to adjust the way we staffed our cases. Erin just talked about, the facility issues. We do staff in a lot of facilities, and we wanted to make sure that there was, we minimized any possibility of transferring COVID between caregivers. So we put into place a policy that any caregiver providing services inside of a facility would not be able to provide services to any other client but that particular client. That actually was brilliant, because we really ultimately we saw 2 client cases and we have a couple hundred clients. So I was very proud of that. But that was a whole staffing challenge for us. But the fear in the caregivers, I mean, we listened to their fear and we communicated with them, and I think we were able to work with them to accomplish, obviously, what we all needed to accomplish. Probably most of our challenges there that we were able to overcome. I think communication was the biggest issue that needed to be addressed immediately and continuously through this whole process. And what we will continue to do this as we hopefully get back to some sense of normalcy. Obviously, it's going to be a new normal, but I think communication will be our biggest saving grace, if you will.
Not sure I can add much to that.
Sallie, so good.
Because my end was mostly financial and making sure that we continued to have the finances we needed to keep operating. And the PPP and the government loans were fantastic in that regard, so we could keep the caregivers happy. And we've actually paid out 2 large bonuses to the caregivers for staying out there and working during the pandemic. So,
and I know that
well.
wasn't, I know that wasn't an easy process to understand. You want to talk a little bit about those things that you had to kind of figure out and where those challenges were with the loans and the, what were they eligible for? Because that's ingenious to give them bonuses to kind of keep them motivated. But how did that kind of the whole process work?
Yeah, it was very challenging. The application process itself was challenging. We weren't sure which banks we could use to go to do it, but we were very fortunate that we are in a franchise system, and our franchisor was right on top of it and provided a number of webinars, as did the chamber and also our accountants, so that we could follow the rules to make the application go through quickly. We got our money very early on. We applied, and within a couple of weeks, we received it. So it was challenging just to understand what the government was doing. And the harder part has been, there have been constant changes. I think the government has changed it 3 times, the requirements. First, you had to pay out at least 75% of it to your labor costs, your payroll costs. Now it's 60%. The number of full-time employees you had to maintain or increase, and we were fortunate to actually increase the number of full-time employees. I think the hardest part coming up is going to be the forgiveness part and the applications for the forgiveness. And quite honestly, I'm spending hours on webinars with the accountants and with our franchisor to try to work through that process. In addition, our controller has been working through the application himself, and it's been difficult, but it was definitely worthwhile coming in, and anybody that's out there that didn't do it should have. It's really been worthwhile. Yeah.
That's great. All of these positive things are so great to share. And so I'm going to remind everybody again, if you're just joining us, I think we had a couple of people join during the program so far. So if you have any questions, make sure you put them in the chat or the Q&A, and we will make sure we answer them at the end. So now we're going to move along to Kevin Kearns, who is the CEO of Tri-State Training and Safety Consulting. Kevin has a unique perspective on some of the challenges that his business has faced during these last couple of weeks. So Kevin, we're really interested to hear how you've maintained and kind of grew through this whole process.
Sure. First off, I'd like to thank the Chamber for having me here. I'd also like to thank those within Delaware County's council, as well as Delaware County Emergency Services, who've really put my company's name out there to let not only local people, but people all around the country. And now we're actually providing personal protective equipment around the world. Through my connections and the relationships I've built over time, we've been very successful in providing personal protective equipment, gloves, thermometers, isolation gowns, shoe and head coverings. If you can think of it, we have it in our warehouse. We can get it within days. I would say the hardest thing has been adapting to the procurement world. Procurement is not what it used to be. Early on, I could say I was the only one working in the office. All of my staff were home. They were afraid for good reason, but I couldn't sit by and not do anything. And they wanted to help, but they did everything they could from home, and they're a great staff. So, but with procurement, as a vendor, as a distributor, I have to go find the product. When I find the product, I need to pay 100% immediately. So that's why we require now clients have to pay us up front. So there's no net 30s. Everything is cash on demand because everybody in the world wants this. Typically, I either have your product here or I tell you I will have it within 3 days, 5 days, 10 days at most usually. And I think we've been pretty spot on with all of our deliveries, maybe off by a day or two. But we are getting the products. We're getting good, reliable products. We vet them all. We make sure they're of the highest standards. Some people are willing to pay a couple cents more with us because the pricing is there. What I would recommend to people moving forward, whether you go to CVS or Rite Aid or Walmart, wherever you're getting your products, don't say to yourself, oh, I can get this in a couple weeks. You can't. Right now, I think 15 to 20% of our economy is operating, and we can't get the supplies in the quantities that we want. So imagine when 50%, 80%, 100% of the economy is back to work. You're not going to be able to open your business. You're not going to be able to keep operating. My recommendation is find a reliable resource, and there's plenty out there, but make sure they're reliable. Amazon is not where you go because they don't have the products. No discredit to them, they're great. But finding a source overseas, a lot of them are scams right now. So find someone you can trust, find someone that has been referred to you by someone who's actually purchased from them, and begin to procure items at least 3 weeks in advance, as much as 3 to 6 months in advance. Right now, we can't get wipes. Right now, we can't get gloves. The pricing continues to rise. A lot of the price increases is not price gouging. I've had several people say these prices are ridiculous. How can you do this? We're making less than 5% on some items. The margins are not there. The cost of shipping, because 90% or more of merchandise in America is made in China. China controls the shipping, China controls the manufacturing, and they control the cost of the raw products. So China controls all of that. Then when it gets shipped, they're charging as much as $1 per isolation gown. An isolation gown weighs as much as an envelope, but they're charging $1 to ship each one, and you can't order less than 1 million if you're ordering. So someone has to order 1 million to get them, so it's $1 million shipping cost for what would normally be maybe $15,000 for them for that kind of quantity. So that's where the prices are. Prices change every day. People ask me for a quote on Monday. If you're window shopping, you're not going to get something. It's just not going to happen. If you get a quote on Monday, it's only good for Monday, because the next day I might have to buy from a new supplier who's $3 higher. Everything changes constantly. Sallie said that they got lucky and they found us, and I appreciate them. And they also referred me for this panel, so I appreciate that as well. Again, they can tell you that there's good products out there. There's bad products out there. I've seen them. Everybody else has seen them. There's different sanitizers now. People don't understand what a liquid sanitizer is. So now we have pure liquid that's being made in the USA. It literally pours out like water. But then there's also gel sanitizer. When you're buying sanitizer, know what you're looking for. You always want 70% or more alcohol, nothing less. When you're buying wipes, know if you're buying a disinfectant wipe, are you buying a bleach wipe? Are you buying a hydrogen peroxide wipe? There are differences, and some of them are baby wipes. A baby wipe is not going to kill a virus. So people are trying to find ways like, well, why is that so cheap and I can get 200 of them? Why is that more expensive and there's only 30 of them? There are different kinds of wipes. They do different things. So depending on what environment you're in, I recommend you look into what the product is. Here at my company, we're happy to answer any questions. We don't want you to buy from us, nothing like that if you don't want to. But again, we're a resource. We prefer email right now because the amount of phone calls and emails coming in is out of control. Well, for a long time, we were only taking calls, or correction, we were only taking orders through email just to keep track of it and have clear cut in writing what people want. Products are available the same day for pickup a lot of times, but again, that depends on the supply chain. So I would say if you're looking for something, order it well in advance. If you're opening in a week, you're going to have trouble getting what you need. So I don't know if there's anything else I could say about the supply chain in general, Trish, but it's really about looking in advance and knowing what you're buying. A lot of people are buying certain thermometers, and when they get them, they only read Celsius. They only speak Spanish. They only deliver in an Asian dialect. Know what you're buying. Read everything. Don't just look at a price and get the lowest price. Obviously, if you know Celsius, that's great, but that doesn't help most people. I know I can't read. I don't know what the difference between Celsius and Fahrenheit. So know what you're buying.
Well, that's great. Have you seen, I mean, you talked a little bit about, it's hard to find the disinfectant wipes now. And I'm sure things have changed throughout these past couple weeks. Sure. Was it a little bit different in the beginning? How has that kind of changed with the demand?
The demand is it's funny. So I deal with others who do what I do all around the country. And on Monday, for example, our phones were all blowing up for wipes. But last week, everybody wanted gloves. So we're seeing everybody wants the same thing at the same time because they're realizing we don't have that. We need that. People are running out. It's not obtainable. For example, we owe wipes right now to a lot of people. We're taking pre-orders. So if you want something, you get it on a pre-order list. And we have pretty precise delivery times. But yeah, I mean, it's changing every day, sometimes twice or three times a day. So literally in the morning yesterday, for example, somebody wanted wipes. It's 7,000 containers available. They were gone in 10 minutes. And by the time the client called me back, they couldn't get anything because their PO process was too long. Mm-hmm. You need to be able to say, okay, yes, I want it, or no, I don't want it. We can give you the price, but you have to be able to say yes right there, or I can't guarantee it. I might give you an estimate, might have to tell you it's no longer available. And then people are asking for better pricing or discounts, and the price is the price. The margins aren't there. We're trying to be very fair. You got to realize that some people, by the time they get it, 4 different people have bought it along the way to get into my hands. So the price has been marked up 4 different times over.
Now that all makes sense. So is there one product that has been more marked up, like with the resale of that? I know what you've been talking about wipes, but has anything else been kind of resold a lot?
Gloves is a high one. Gloves okay. Are really high. So pre-COVID, you could get a box of 100 gloves for about $5 to $6. Now you're paying anywhere from $15 to $24 a box, depending where you get it from. There's different kinds of gloves. Know what kind of glove you're buying. Is it latex free? Is it powder free? Is it 3 millimeter? Is it 6 millimeter? The thickness of the glove. There's all kinds of information. Is it an FDA approved and certified glove? There are fake FDA certs out there. Know what you're looking at, or ask someone who really knows. Just because it says FDA and certified does not mean it's approved. People were buying products that were approved on Monday by the FDA, and on Wednesday they were removed from the list because they're no longer approved because they did not any longer meet the standard. So then you have a lot of product that is not good. So our guarantee is that when we buy it, when it's in our door, it was already vetted and it was already approved. Once it leaves our door, we can't guarantee anything. We're not the FDA.
That's crazy that the FDA requirements have changed that quick. And I know that you probably all are dealing with those quick changes. And, one thing, one day something you think is right, you're doing that. And then the next day you have to change everything. And Clark, I'm sure you can kind of talk about with the PPP loans, like how those things, you went in thinking one thing and this is what I'm applying for. And then all of a sudden it's something completely different. And you talked about that a little bit, but is there anything else you want to add on how those changes can drastically change your day?
One of those changes was originally you had to use the PPP funds within 8 weeks. For use them up in your payroll, or it could be payroll, could be interest on mortgages, but certain things. Now it's 24 weeks. So it's been, and we just ended our 8th week. So you have the option of going 8 weeks or 24 weeks. So that's a huge difference. We wanted to get it done, get it over with. So we did the 8 weeks because that's what it was up until last week.
That's crazy. So week 7, they're like, oh wait, you have longer time, but you've already spent it.
But we've already used the funds.
Yeah.
So that kind of thing is interesting. The other thing is going to be the forgiveness. We don't even know. They're unanswered questions. You know that if you've spent it for certain things, it will be forgiven. So you will not have to pay it back. The question we have now is we don't know when we can file for forgiveness. Because they've extended it out 24 weeks, we don't know whether or not the forgiveness applications can't be filed until at the end of December next year. And if it's forgiven, the IRS has already determined that you cannot deduct the expenses that you've paid with the PPP monies. So that's going to create a huge income tax liability at some point next year. So I don't even know if I can file for forgiveness before we have to pay the taxes, or whether the taxes, will ever be there or will be charged. So
there's no way to plan for next year. There's no way to plan for your taxes. It's just all like, oh, well, we're going to decide to do this, and then maybe we'll change it, maybe we won't.
That's true. That's exactly. We're actually going to be meeting with our accountant in a week or two just to decide or come up with alternate plans. What if this happens, and what should we be doing? What if this happens, and what should we be doing? How much should we be paying in estimated taxes, or shouldn't we? Those kind of things. But it changes.
So as a business owner, you can't even predict what okay, these are my taxes, this is what the percentage I pay, and this is how I can plan for that. But now you have no idea. Absolutely no idea. No, you can't plan, you can't set aside.
No.
Frustrating. Completely frustrating.
It's very frustrating.
Trish, to that point, we had some similar discussion over here where just employees, were saying, we get the money in, get the funds, it'll really help and so on. But as a business owner, we don't know the implications. There is liability in taking this on. It's not free money. A lot of people think this is free money. If you're getting the PPP loan, or if you've gotten it, continue to educate yourself, continue to follow up with your financial advisors. Nothing is free. There's no free money. At the end of the day, will a lot of it be written off per se? Sure, but there's criteria, and within the loan, they state they can change the terms at any given time, which, as Clark said, they just did last week when they extended to 24 weeks, which is a great thing. It's not a negative, but who knows what they'll do down the road. You're basically signing a contract that says we can change the terms when we want to.
It's scary. I sit on a nonprofit board, and they had to lay off a number of employees. And as they looked into, we, said, okay, yeah, apply for the PPP money. And then we sent it back. There were too many unknowns, and they, with that 8 weeks, and they couldn't open. So it's scary that with all of the ramifications, you don't know what's going to change from day to day. And there's really no guidance except to kind of keep saying to the federal government, hey, can you kind of get it together so we can plan as business owners, because that's scary. Sallie, I know that you've dealt with a lot of your the caregivers, and speaking of scary and overcoming those fears, and with the dementia patients too, we talked about that. How did you, or were you able to kind of help your caregivers kind of offset that fear of the unknown and going into work, and you don't know what's going to happen? Did you do anything differently, or kind of motivate them through that?
No, we assured them. For instance, many of the caregivers stayed with one client, and the clients that are in their homes, their residential homes where they've lived for 20, 30, 40 years, safest place for them to be is at home. So they were really isolated in their homes, and that was a very assuring to the caregivers, because the likelihood of COVID coming into their homes was minimal, if not almost non-existent. So the commitment that a caregiver had to a particular client continued and stayed the course throughout this whole process. we really limited our caregivers from seeing more than one or two clients. So minimizing the risk, or that was the thought process. And I think we accomplished that. Same for the dementia clients. I mean, dementia clients are so isolated as it is, and just being able to assure them, I mean, they don't know what's going on, and just being able to assure them that the differences, one of the things we did was the caregivers might come in with a fun mask. So we fund up their mask, and we gave the client the same matching mask so that they were twins. And the dementia client thought that was a lot of fun. So again, just, and honestly, the caregivers know the clients so well. They've been with them most likely for a very long time, and very committed to them. So they were on board with whatever needed to be done to make the caregiving happen, and to keep us out there, and the service process continuing. Yeah.
And Erin, I'll kind of direct the same question to you. No one wants to have to deal with hospice at any stage, but hospice is so caring and is so giving. But during the COVID crisis and these last couple weeks, there are a lot of people that are passing that don't have COVID, and their families aren't able to see them or aren't able to be with them. Was there anything that you and your team have done differently during these past couple weeks to kind of reassure or anything like that?
Many phone calls. I've called, myself and talked to different family members and whatnot. I've even met with certain family members at a distance. We both had masks on, just to, talk and just, get them through these moments and these times. I will say that some of the facilities did allow, at the very last minute, when they were imminent, for the families to come in and see them for those last couple hours. So it was very few and far between, only certain facilities. So that was helpful at the same time. And then I wanted to, kind of tag off with Sallie a little bit. You had mentioned earlier about the fears and how did, we kind of help out our team with the fears. I just want to say that, under Amedisys, we're compassionate care hospice under Amedisys company. They were very, very, very good at extensive education, information daily, from the CDC, just updating us, keeping us very informed, pre-screening. We all had to do pre-screening every day, the same thing on a phone, send it in. If we had a fever, we weren't allowed to go to work or, clock in. So a lot of webinars, they were very informative to keep us positive and keep us going to, focus on that, minimizing the risk for us and for everyone else.
I'm sorry, I was muted. That's great. And I really do think that motivation and that kind of personal touch to the clients, no matter what industry you're in. And I think you all have seen the same thing, just that constant communication, like, here's what it is, clear, concise, and the way to handle that. So we do have I am so sorry if you hear the background noise here. So I think this is more of a comment than a question here. Before we close up, I will remind the panelists, or not the panelists, the people in the webinar, if you have any more questions, please let us know. But are there any last final things I didn't ask, contact information, that let us know how these people can contact you, and if you want to kind of leave any lasting thoughts as we close today.
I'll start. Just an additional comment. We work with Erin's company in hospice, and the hospice piece is so vital, especially during all of this, because what we do, home care, is considered essential business. We are able to go into the facilities, the senior living residences, and still provide care in those residences. We've worked with hospice companies in end-of-life situations inside the facility. So our hands-on has been able to continue. And so if you have a family member or anything who's in that situation, we can certainly help with that and bring hospice into that mix as well. So, we're in Springfield, we're in Chester County, we're in Montgomery County. We can, we're on the internet, you know, look us up, Comfort Keepers, where my husband and son and I own it together. We're a very hands-on company. We're in the office every day and involved and engaged in the company every day. So if you need us, we're here for you.
Just want to add, if you just put our name.
Yep, you're muted.
I think there might be a little bit of an audio connection issue with Clark. So Clark, we can't hear you. So we'll come back to you. Maybe it'll work out. Maybe it's just a bit, you know, the internet kind of goes in and out. Erin, everything else, is there anything else you want to close with? Contact information?
Yeah, just to kind of tag off what Sallie said. I mean, thankfully, because we can work together with the caregivers and whatnot, where they have more access than we did, was huge, just to be able to still communicate, still have somebody familiar, you know, for the patients and whatnot. So, you know, that's basically, you know, I just want to thank everybody as well. Thank you for you know, for having me and whatnot. So, and thanks.
Thank you. Kevin?
Again, thank you everybody for having me on this panel. I would say if anybody wants to contact me, my email is info@tristatetraining.com. Our phone number here is 866-503-3430. We're located in Ridley Township. We deliver to your door. You're welcome to come pick up the products that we offer. Our main services outside of doing PPE is CPR training, which we're known for around the world. And we also provide fire extinguisher services. And as a little caveat right now, anybody who needs fire extinguisher services at their business, we're going to donate medical supplies to you for contracting with us for those services. So a way to save you money because you're going to end up spending it with someone else. And all orders have to be through email or on the phone. We're not putting items on our website because, as I explained, supply chain is supply and demand, and they're available 1 minute and not the next. And there's a lot of work to list an item on a website. So again, please email or call us if you would like anything.
Absolutely. Kevin, thank you so much. Clark, let's try it again.
Can you hear me now?
Yep. Yeah.
I'd say anybody can reach us by email with our names at comfortkeepers.com. Otherwise, we also have offices in Orland, King of Prussia, Springfield, Chadds Ford, Westchester. Call us at 610-543-6300, and you can reach either one of us or anybody on our staff. So
that's great. Thank you. Thank you, Clark, Sallie, Erin, Kevin. We really appreciate you taking the time today to be with us. And if anybody on the webinar or watching this on YouTube has questions or wants to be connected with the panelists, send us an email or reach out through our website, and we will definitely connect you